Cholera is bacterial infection which causes diarrhea, and it can cause death in several hours if left untreated. That's why it's important to diagnose and treat cholera as soon as possible, because it has 50% of death rate if left untreated. And if it's treated properly, death rate falls less than 1%. That's why it's so important to treat cholera. What is mechanism and how it causes symptoms, and what is most important symptoms? So cholera is bacteria which is caused by Vibrio cholerae. It's bacteria, you can see on the image, and cholera affects small intestine and colonizes in small intestine, and it releases toxin which is called cholera toxin. Cholera toxin affects cells and it causes overstimulation of enzymes called adenylate cyclase. It causes excretion of chloride ions, and this excretion of chloride ions causes also excretion of water and sodium. So person loses lots of water and sodium and chloride ions, and person can lose more than 10% of body mass in several hours. That's why it can cause severe dehydration and shock and eventually death. Now, what is important symptoms? Most important symptom is sudden severe watery diarrhea. It's most important, and this diarrhea is very large volume. It's even frightened for patient, and patient can say that it's frightening large volume of diarrhea. And this diarrhea has rice water stool appearance. It means it's white and milky appearance. It's characteristic for cholera. And if person lives endemic area of cholera, and endemic area of cholera are areas where there is no clean water, such person, if such person has sudden severe watery diarrhea, we should always suspect cholera first. Cholera can cause also nausea, vomiting, muscle cramps, but it's secondary symptoms and not very important symptom. Most important is severe sudden watery diarrhea. Diarrhea is very large volume, we should remember it, and we should start treatment as soon as possible. For diagnosis, gold standard is to detect cholera bacteria, but we usually and in practice we don't wait for confirming diagnosis. We start treatment as soon as possible because it's life-threatening condition, and treatment is oral rehydration therapy. If commercially available rehydration therapy is not available, then we use half of teaspoon of salt, 6 teaspoon of sugar. It dissolved in 1 liter of clean drinking water, and person should intake this water. Also, some foods which are rich in potassium, such as banana, orange, or potatoes, person should eat after several hours drinking this solution. Doxycycline is antibiotic, is used in adults. Azithromycin is used in children and pregnant women, and WHO organization also recommends zinc supplements for kids to shorten duration of the disease. That's all I wanted to say. Cholera is really important disease. We should pay attention, especially in developing countries where there is no clean drinking water available. Thank you very much. If you like my video, please thumbs up. If you like my channel, please subscribe.